obese, and then we talked about obesity, especially that visceral fat, can lead to insulin resistance, which can knock you, which can push you into being a diabetic. So yes and no, right? Everybody with me? You guys gonna be looking like you with me.
Yeah.
That don't make sense.
What doesn't?
If either, it's not an either. Not I don't know how to say it, but sugar. How can't sugar cause diabetes?
Because sugar itself doesn't. The fact that you eat sugar and begin to gain weight, that weight can cause you to become a diabetic because of that increased weight and that visceral fat.
Visceral fat.
The visceral fat,
Oh,
but
like
not
that pregnant
necessarily, but not the sugar that like you pour in coffee.
Right.
That doesn't cause diabetes.
Okay.
No, if you keep eating high amounts of sugar, high fat, things like that, it's going to knock you into, make you obese. And then just that obesity itself has the propensity to give you so many other conditions that are not healthy, diabetes, heart conditions, all kind of high cholesterol. So just obesity itself, especially that visceral fat, can cause diabetes, but not sugar itself.
Man.
Got it?
Yes.
Okay.
Got it.
Let's go to the next one. Diabetics can't eat fruit. I know Angie is, she is fixated on the fact that she can't eat watermelon. And I'm like, yeah, you can. You can eat. Okay, well, I already told you that answer. So yeah, you can. You can eat fruit. Diabetics can eat fruit. So although fruit contains natural sugars, they are in a form that can be safely consumed by diabetics, but in certain portions. So with diabetics and what they eat, and that is a whole nother thing, because I was going to add food and nutrition to this webinar, but y'all, it's just too much. So just going to touch on it. So diabetics can eat natural sugars. It's actually better for them, but they have to eat everything in portions, everything in a moderate amount, and not just I remember what a doctor in Columbus told me. She was like, whenever you feel like you want to lose weight, she said, get on a diabetic diet, even if you're not diabetic, because they have to do portion control. They have to watch carbs. They have to watch fat. They have to do everything. So she used to tell me that. She was like, just follow a diabetic diet, because they actually are doing what we all should be doing. Okay. Insulin or pills are enough to control diabetes. Is that myth or fact?
Myth.
Myth.
Say that part again, Liz.
Insulin. So these are myths and facts, Erica. We're trying to bust up some myths about diabetes.
Okay.
So insulin or pills are enough to control diabetes. Is that myth or fact?
Myth.
Myth. Okay. So we're going with myth. All right. This is a big one, y'all, because y'all know how we are as Black folk. Y'all know how we are. If I got sugar and I got my insulin, then I can go and have that piece of red velvet.
Right.
That's how we think. So your medication is intended to help your body maintain healthy sugar levels. Eating foods that prevent your medication from doing its job can be counterproductive. So if you're taking insulin to help manage that blood sugar, but then you consistently eat things that you shouldn't, that's going to take that blood sugar up, you're kind of fighting against what the medicine's trying to do for you. So insulin or pills aren't cures. There aren't cures for diabetes. So you have to be very careful. They're management for diabetes. Okay, they're keeping those blood sugars level. All right. Fourth one, artificial sweeteners are the way to go.
False. Myth.
Right. So although the FDA allows the use of saccharin, aspartame, and sucralose, those are all artificial sweeteners, the Centers for Science in the Public Interest of Health consider these sweeteners risky. While the labels claim no added sugar, these products do contain sugar in the form of sugar alcohols, which can lead to intestinal dysfunction. So when you're eating, like y'all always hear me tell Angie, when you're eating those artificial sweeteners, I holler at PJ all the time, when you're eating those things, you still have to be careful. For one, they're man-made. For two, all kind of other things that could put you into another category of health risk. So you just have to be really, really careful with those. I know have some people tell me that eating that they've gotten addicted to that Diet Coke, mostly because of the caffeine. But even by eating, drinking the Diet Coke and all that aspartame and sucralose, it makes you even thirstier. So you drink more. You eat more. You're not satiated the way you would be with another type of drink. So just be careful about the artificial sweeteners. Okay? Diabetes is not as serious as heart disease, so it's not that big of a deal.
Oh, yes, it is.
False.
Right, right.
Yes, it is.
I know that. Yeah, that's it.
Diabetes causes more deaths per year than breast cancer and AIDS combined.
Oh,
Wow.
wow.
And having diabetes nearly doubles your chance of having a heart attack. So if you don't have a risk of heart attack and you're diabetic, you have doubled your risk just by being diabetic.
Wow.
So that's what I wanted to bust. It's a lot of other myths out there, but for the purpose of time and just the importance of these that I hear all the time, I wanted to throw those out to you guys. All right, so we can bust all of that thinking up.
Oh, that was good.
So, what can we do? What can we do to prevent and manage diabetes? Prevent if you don't have it, manage if you do. All right. So, on the left side of my screen, it says prevent diabetes. But I want you guys to pay close attention. Prevent diabetes. Exercise, skip sugary drinks, don't smoke, eat more veggies and fruits, get active, manage weight. Now, those are things we can do to prevent the disease from happening. Outside of the fact that if you have a family history of it, have a lot of that visceral fat, if you have a sedentary lifestyle, yes, you want to get yourself tested for sure. But if you're a regular person like me, you guys, this is what we can do to prevent diabetes. Although I'm almost sure that it's not in our family history, but still, you don't want to throw yourself into it by being, overly obese or whatever. So what else I want you to take a look at is, hold on, I can't see. Ooh, I just covered my screen. Sorry, y'all. Hold on one second. Okay. So what else I want you to look at is on the right side of my screen. This is managing diabetes. Drink a moderate amount of alcohol, if any. Stop smoking. Follow a healthy diet. Exercise regularly. Test glucose levels regularly. Take medication as prescribed. Now, what I want you to pay attention to is how very similar these are. If you look on both sides of the screen, they're pretty, outside of taking your medicine and checking your glucose, they're pretty much the same thing. So what I want you to understand and how important it is to see that prevention is management. It is management. So if you prevent diabetes by doing these things, and if you have diabetes, you can manage it by doing the same things. So if you look, just don't do it. Just do prevent diabetes, and then you won't have to worry about it. Because all the things you're doing anyway, if you get it, you're going to do the same things.
Mm-hmm.
Wow.
So just want to put that out there, guys. I wanted you to see the similarities so you can see you're not doing anything different to not get the disease. And when you get it, you're doing the same thing that you would to not get it.
Mm-hmm.
So keep that in mind. That is so very important. All right. So when it comes to type 2 diabetes, prevention is important. It's important to make your prevention a priority if you're at an increased risk, such as if you're overweight or if you have a family history of the disease, or if you've been diagnosed with prediabetes. So it's making what we talked about, making a few simple changes in your lifestyle now will help you to avoid other serious health complications in the future, okay? All right. So what else can I do? I can get more physical activity. Benefits of exercise, we all know what that is. Losing weight, it lowers your blood sugar, it boosts your sensitivity to insulin, which is a good thing. You get non-diabetics, when you work out, you don't even know that's what you're doing. You're boosting your sensitivity to insulin. You're making that process a lot smoother. of that exchange of glucose and insulin, and you're making it so much smoother when you're working out. It just makes your body more receptive. When you get
Wow.
plenty of fiber, all right, that's another thing we can do. I feel like in our community, we don't talk about fiber and whole grains enough. And like I said, I wasn't going to get real deep into food and nutrition, but I thought it was important to mention these. Fiber helps you reduce your risk of diabetes by improving your blood sugar control. Just fiber, just eating fiber.
Wow.
The risk of heart disease, promotes weight loss by helping you feel full. So some foods that are high in fiber are fruits, vegetables, beans, whole grains, and nuts. These are simple things that we can incorporate into our diet. It doesn't have to be every meal, but just make sure you throw it in there. You having a salad, throw some nuts on there. If you're having baked chicken, make some beans. Have some beans with your chicken. If you know that you're having some omelet, throw some peppers and spinach and mushrooms and onions in there. Those are 4 veggies right there. So I'm just saying we got to start thinking like we want to feel better and we want to be better. Okay. Go for whole grains. This is another one we don't discuss in our community. It's not clear why, but whole grains may reduce your risk of diabetes and help maintain blood sugar levels. So what they're saying is studies have shown that whole grains will almost do what somatostatin does. Remember the somatostatin that we talked about that kind of regulates the glucose, and it kind of will do that. So do you see how, and I don't want to be religious because this is not that platform, but just do you see how God put everything in place for us to take care of ourselves?
Wow.
And the beautiful thing about it is he even has things in place when we don't. That's how loving he is. I had to put that out there because I just love talking about the body because you can't help but think about what he does for us. All right. Lose extra weight. If you're overweight, diabetes prevention may hinge on weight loss. People have lost weight and stopped being diabetic. No joke. It happens. Okay. Every pound you lose, get this, every pound you lose, you can improve your health, and you may be surprised by how much. A large study showed participants who lost just a modest amount of weight, 7% of their weight, and exercise daily reduced the risk of developing diabetes by almost 60%.
That's insane.
Just 7% of your weight, 7%. You reduce your risk of diabetes by 60%. All right. Skip fat diets and make healthier choices. Low carb diets, the glycemic index diet, or other fat diets may help you lose weight at first and fast. But the effectiveness at preventing diabetes and their long-term effects are not known. And in the science and medical world, are not known to us means not safe yet. Okay, so that's how we look at it. And by excluding or strictly limiting a particular food group, you may be giving up essential nutrients and often crave such foods. So you might put your body in a crave mode where you have to even battle even more not to eat it, just by eliminating food groups that you need anyway. Okay. Instead, make variety and portion control part of your healthy eating plan. That's all. I think that's all I'm gonna really say about food. Food. All right. Everybody clear? We good before we move on? All right. What else can we do? We can see the doctor. Now, you know, in my webinars, I'm going to always talk about going to see your physician. It is what I'm about. It's what the Health Hub's about. That's what we are going to push, and making sure that you have a PCP. And if you don't, Tyson Storehouse, we can help set that up. And if you do, we want you to get excited about going to see your doctor. I think my last webinar, I talked about you only have to see your doctor about 2 times a year. 2, unless something's going on. Okay. So you want to see your doctor with concerns that see the doctor with concerns about diabetes if you are overweight with one or more risk factors for diabetes, such as family history, you have a personal history of prediabetes and an inactive lifestyle, or 3, you begin to eat more, urinate more, and drink more. And anytime I'm talking about more of anything in my webinars, I'm always talking about to the excess. So if you're eating more than you normally do, like you can't get enough, you can't feel satiated, you don't feel full, you're peeing more, you're getting up to the bathroom, every time you look, you gotta pee, and you're more thirsty, your mouth, Tasha, it's not you, but please, y'all can see, did you see?
I'm glad you said. I'm glad you said it.
This is why I hate these, because Tasha, every month she got it. Whatever
She
problem.
got it. She got it. Last month she had heart disease.
Yeah,
That was
heart
lady
failure.
had it last month.
Yeah. So if you notice those things are happening, please go see your physician. The eat more, drink more, and pee more are the three most common kind of giveaways for diabetes for us. So if you're noticing that, please make sure you take care of that. Okay.
Okay.
All right. Support groups.
I had a quick question about the
Yeah.
when you said we only have to see our uh, primary care doctor twice
Uh-huh.
a year. What are we asking saying it? Like, will we call and say, hey, I need to make an appointment for my yearly physical? That's one. What
Mhm.
else am I going for? Like, what would be the two reasons I need to go opposed to one?
Well, so if you have gone to the doctors before, they're going to set you up an appointment 6 months later. They're just going to
Oh,
you want to follow up. They want to
oh,
see how you're doing. It's not really, yes, it's their job, but they some of them genuinely want to know you're okay. They want to
okay.
check your levels. They might schedule you 3 months out if they see that your lipid levels or your cholesterol levels are borderline. So they want to bring you back, do some more labs, and make sure we're staying at those levels. Or or if you're doing good, if everything's looking good, they just want to see you back in 6 months to make sure things are looking good. They might need to readjust your medicines. Now, in between that, if you need them for whatever, if you're not feeling well, just something's off, your medications don't make you feel good, the ones you first, let's say new medicines, started you on a med, they want you to try it out. They want you to call you back if you're having problems with that med.
Okay.
Black people, unfortunately, we have a really bad reputation for follow up. We'll go when our body makes us go, but as far when we feel better, more than likely we're not following up.
Mm-hmm.
And that's what the one of the another high point of the health hub is that I want to try to just get rid of. It's just one of those things that almost follows us. The doctors know it. I hate that they know it and they kind of use that almost. So
Mm-hmm.
we have to treat our bodies well. We got to be better to ourselves. And once we are, we will show these physicians that we mean business about our health. Yes,
That's
I'm
right.
calling you. Yes, I'm calling you again. Hey, I don't remember when my 6 month appointment was, Dr. Smith. Oh, okay, it's on. Okay, I'll write that down. We have to be intentional in
Mm-hmm.
following up with our health, even when we feel great. Okay. All right. That's my spiel. So
Thank
to
you.
answer your question,
Yeah.
yeah. So support groups and families with diabetics is so important to make sure you have the support that you need, especially if you're a new diabetic, you don't know anything about it, you need that support group. You want your family on board because you want them to understand how you have to eat, how you have to take your medicine, how you have to get your exercise in, how you have to check your blood sugar. All of that, you need all of that support. I was going to list some groups on here for support groups that you can kind of link into. But there, y'all, I look, there are numerous. Diabetes is not new and it's very common. So everybody is out there and they do it by areas. So if you are in an area, all you have to do is Google diabetes support group Austell, diabetes support group Marietta, whatever it is, you can Google that and they will, all kinds of stuff will come up. I mean, all kind of things. They do it according to what you can do. If you work at night, they got morning classes. If you need, they need to come to you. I mean, it's all kind of things out there.
Wow.
There's also online support groups as well, which you probably will see more of because of COVID. But it's out there. So if you know somebody or if you have it yourself, please, please, please get the support you need. Okay. So
Do you recommend any? Do you have any that you recommend?
I didn't, and like I said, I'm not. I did a little bit of research on it, but every time I try to put in something about diabetes support group, so many things came up.
Okay.
And like I was saying, it's kind of by area. So it depends on what county or area you're in. You just put diabetes support group in your city, and you will have massive amounts of information that comes up. And that's all really you have to do. It's just a matter of picking which one fits for you. If these things go down to your lifestyle, what works best for you, they will come to you. So it is that important, and it's out there. So just make sure you have that support. Okay.
Okay.
Oh, that's it, guys. That's it for me. I do have some COVID updates though, but I just wanted to end this part of the webinar about diabetes. I hope you all enjoyed it. I hope you had fun. I hope you learned. Do you have any questions? Is everybody good? We good? We know what insulin does? We know
It's the key.
It's the key. And glucose knocking, right?
Right.
Knocking, and insulin gonna open the door. But if the door not broken, can't. That's for type 2.
That's type 2. They can't.
That's type 2. But type 1 ain't no key because there's no insulin.
Right, because they can't make it themselves.
They can't make it, so there's no insulin at all. All right, so type 1, yeah, that sugar builds up in the blood because there ain't nobody there listening out. Glucose is glucose everywhere in the body, in the blood. And they try so hard to get in the cell, ain't nobody answering that's type 1. So that ends that for that. Y'all good? Got some understanding? Perfect. All right, so let's talk really quick about some COVID updates. All right, I know that's still one of the things I think is ever present with us for probably no telling how long.
Right.
I will tell you the updates. They were updated yesterday at 4 p.m. So new cases in the United States is up to 4,163,892. That's not where we are overall. That's just the new cases.
That's crazy.
Okay.
Wow.
The new deaths are 145,942. Now that's good, but it's not good for my aunt who I love to death. I'm not saying it's good. I'm just saying I hate that people are even dying from this, but what it was, we're not at a huge increase in the deaths. We're in a huge increase in the cases. Okay.
Oh, okay.
All right. So what we know, testing has increased, right? So the total tests reported since today, I think today was the update. The total test reported from all the states total 52,945. Now those are the tests that's reported that they tested and they reported them back to the CDC. Out of those tests that were reported, 5,046,506 were positive. Okay, I should have wrote those numbers. It's because it's hard to, when it's that much, it's hard to get those numbers in your head. I should have wrote them. Let's just say over 52 million have been tested and reported, and over 5 million have been positive. Out of those 52 million, 5 million has tested positive.
Okay.
Is that a small percentage?
That's a 10%.
That's a pretty small percentage, right?
No. It's 10%. It's a 10%.
Okay.
Right. So that's good. That's good. So some of the reasons that for the increased numbers, the CDC is they were on. It's so funny because I really never know the relationship between CDC and Trump. Never sure.
Right.
I'm like, should we listen to y'all? Yes, no.
Right.
Right.
So from them, they're saying that yes, it seems as if because we're testing more, that's why we're getting more positive outcomes. But
Uh-huh.
they're saying that's just a small percentage of why we're increasing. They're saying that it is definitely because we have strayed away from the strict adherence of the conditions.
Mm-hmm.
And that is social distancing, face mask, and hand washing. Okay. Many businesses are opening back. I know you guys know that, but many of them are opening back with strict conditions. So some of them, I think Walmart and Target last week have started where you can't get in without a mask. A lot of restaurants are doing that, but a lot of people aren't. So you have to be weary of those things. You have to do what you can do. It doesn't matter that whole businesses aren't requiring masks. You know what you should do. Okay.
That's right.
Several mayors of Georgia, including Keisha, has required mandatory masks, and that's just got through saying that that's a good thing because they understand what we can do to flatten this curve. It worked before, and it can work again. We just got away from it. Okay.
Mm-hmm.
So what's important, right? Nothing has changed about how we stay safe. Now numbers are increasing. Positive tests are increasing, people are still dying, but what hasn't changed is how we stay safe. And how we stay safe is social distancing, mask, and hand washings. Those have not changed and will never change. Okay? So you can guarantee that if you do those things, you're gonna keep yourself as safe as you can. I'm not guaranteeing that you won't get it. I'm not saying that, but you can do what you can do. Okay? Stay out of crowded places. If you know you won't be able to social distance, don't go.
Mm-hmm.
Okay? If you know that there's someone that you can, be able to, well, I think I can go because it's a pretty big place. I can be over here, or whatever. I feel like a park is a good example of that. I think you can social distance in a park. You can't social distance at a party. You just can't. Somebody gonna talk to you, you're gonna be in somebody's face, especially when drinks and alcohol start going around, everybody feeling good. Now everybody loves you. So now they're all in your face. So you if you can't do it, don't go. Okay. There is a such thing as positive asymptomatic people. That's real. It exists. So you're feeling good and you can be positive. You know that, and that's fine, but that's the whole reason for keeping yourself and others safe. Okay? And remember, nothing has changed about how the virus gets out. It still now they're saying it's another strain. Like it's a lot of updates. I didn't even bring it because I can't even understand the level. But now they're saying it might be another strain. Now they're saying that it might last in the air longer than they thought, but there's no definitive on this, y'all. So I don't chase that kind of stuff until it cements for me. So it's not really anything for me to report to you. I just don't think it's valid enough yet. Okay. Okay. So what is valid is staying, is keeping yourself safe. Mask, social distance, hand washing. Okay. That's what I got. That's the updates I got for y'all. There are other things that are happening as they come. Of course, what to do. I'll keep you posted. But there's nothing out like just, oh my gosh, so unreal right now. Okay. So yes, cases are increasing. We see it in the hospital. We definitely got more COVID cases now. I think the deaths are still kind of they're there, but they're nothing like they were. But positive cases are increasing. So we do see it in the hospitals. I think we watch TV. Texas, I think, has kind of capped out on what they can do. Their hospitals are like full. In several other states that's the same way. So just do what you can, y'all. I know sometimes it feels hopeless. Like I'm wearing my mask, people still getting it. Now, I mean, why even wear the mask? Don't listen to that. Just know that it worked before. It really did. It really did. It helped flatten that curve. And that's how we were able to try to slowly open stuff up. But when we did, people just went crazy. Just stick with it. Stick with it. And remember, think about others. And if you think about other people, you'll put on a mask. Okay?
Okay.
That's all I got, y'all. Thank you so much.
That told you.
It sure was.
I have so much fun with these. because it's such a way to break things down and make you understand. If I can say it in a joking way or in a funny way or in a way to make you understand that I have done what I wanted to do. So yeah, thanks guys.
Yay, that was great. Thank you so much,
Yeah.
guys.
Yeah.
Well, Miss Best,
Yeah.
thank you.
Yeah, you're welcome.
Yeah, that was really good. That was good. I like that.
Good. So stay
Yeah.
tuned. Next month, you'll be seeing stuff, of course. I think I take Tasha, my boss, allows me to take like a week off before I got to start posting again. You'll be hearing about it next month. We'll be talking about hyperlipidemia, that is high cholesterol. So you don't want to miss it. It's gonna be good.